Good evening, Tewksbury. It is 6:01 p.m. on Thursday, February 18th, 2021. I'd like to call this meeting of the Tewksbury Board of Health to order.
I just worry about my call.
First on our agenda tonight is approval of minutes. And we'll do a quick roll call. Jason, if you'd be able to send Robert Scarano a new invite. He just texted me. He's looking for the invite.
Okay, can do that now.
And then he should join. So we'll do the roll call. So it's myself, Ray Barry, Chair. Maria?
Maria, you're muted.
I'm muted?
Maria Zaroulis is here, present.
Okay. Okay, good.
Okay. Tony Bichetti is here.
And Charlie?
I'm here.
Okay. And from the Health Department?
Shannon Sullivan, Health Director.
Urvi Agarwala, Public Health Nurse.
Michelle Grant, Health Agent.
To be? Okay, we'll get started, and Mr. Scarano should be dialing in momentarily. So the first item on the agenda tonight is approval of meeting minutes from our January 21st, 2021 meeting. The minutes that were sent to you were reviewed by both Clerk Maria Zaroulis and myself, so it has our edits. And I just ask if members have any comments or questions or edits on the minutes.
I do not.
Okay. And Mr.
Nothing
Rue?
here, Mr. Chairman. Nothing
John?
here.
And Ms. Zaroulis?
I don't have any comments to add.
Okay.
Thank you, Maria.
So if someone would like to put forth the motion to approve the minutes as submitted, I would entertain that.
I'll make a motion to approve the meeting minutes.
Okay, someone willing to second the motion?
I will second the motion.
Okay. Dr. Bichetti has put forth the motion, and Maria Zaroulis has seconded the motion to approve the minutes of our January 21st, 2021 meeting as submitted. All those in favor will signify by saying aye, and I'll take a roll call vote. So Maria Zaroulis?
Aye.
Dr. Bichetti?
Aye.
Mr. Rue?
Right.
Chair votes aye as well, so motion carries unanimously 4-0. Okay. And I see another caller. Is that you, Mr. Scarano?
It is me, Mr. Scarano. Thank you, Mr. Barry.
You're welcome. So we just approved the minutes for the last meeting. We're going on to introduction. So we have introduction, Michelle Grant, our new public health inspector, and we'll also need to appoint her as health agent, even though we do the normal appointing and reappointing in our April meeting. We do need to appoint you as a health agent tonight. So Michelle, welcome to the department. If you want to introduce yourself to the members.
I'm Michelle Grant. I'm a health inspector agent and have been an agent for almost 20 years. I'm excited about being in Tewksbury.
Okay. Any members have any questions for Ms. Grant?
No questions, but just welcome. Happy to have you.
Thank you so much. Really happy to be here.
Well, good. Well, I know you'd be.
Michelle.
Is that Charlie?
No, I've known Michelle for the 20 years that she's worked pretty much, and I've never had a problem with her. I think she's very capable, competent, and she's easy to get along with.
Thanks, Charlie. What a guy.
And that will shorten up your drive for you, Michelle.
Say it again.
That will shorten up your commute for you from Chelmsford to Tewksbury now, right?
About 2 minutes.
I would like to welcome Michelle and congratulations and good luck. But for the record, I would like to say that I think as a Board of Health, it would be nice if we maybe had a chance to meet some of the people applying for the position, so we could just get a little first impression on this end. And it's solely for the record. I hear Michelle has some great credentials, so I do like that. But for the record, as a board and for future boards and for future times when people may be applying for positions and everything, I think it would be beneficial for board members to at least kind of know who's applying for the positions and, meeting with them and before a decision is made. And that's all I would like to say. But welcome, Michelle, and congratulations.
Thank you very much.
Michelle, Vice Chair Bob Scarano, welcome aboard and congratulations on your 21st year.
Thanks so much.
Okay, so now we have to do the official business of someone like to make a motion to appoint Michelle Grant as a health agent of the Tewksbury Health Department.
I can make that motion if nobody else speaks up.
Okay. So Mr. Roos put forth the motion. Who'd like to second the motion?
I'll second the motion.
Okay. So motion's been put forth and seconded to appoint Michelle Grant as a health agent for the Tewksbury Health Department. All those in favor will signify by stating aye, and we'll take a roll call vote. So Vice Chair Scarano,
Aye.
Ms. Cirulis,
Aye.
Mr. Rue,
Aye.
Dr. Bichetti,
Aye.
the chair votes aye as well, so motion carries unanimously 5-0. So now you're officially a health agent, Michelle.
But thank you, Doctor.
So, old business. We have 2 items tonight. Both are continued. First is COVID discussions. Originally, we were going to have a COVID discussions with elected state officials, and having worked at the Chelmsford First Responder COVID-19 vaccination clinic last Wednesday, I learned much more than I did the first time I was there 4 weeks ago for the first dose clinic about challenges that communities were having in receiving or not receiving doses of requested vaccine. And I had gone through an effort to pull in the other communities in comprise our medical reserve unit region. And we had members from 5 out of the 6 health departments, and we had some town managers or administrators that were going to be in the call, and we had a handful of state senators and representatives that were going to be in the call, and then Secretary of Health and Human Services, Mary Lou Sutters, issued a letter to local boards of health yesterday morning that essentially negated the need for our meeting or having a regional meeting. So I canceled that. But I just want to mention a couple of things as it relates to COVID vaccine and specifically for residents of Tewksbury. And then I'll turn it over to you, Irvi, for more descriptors. But the state did roll out a new vaccination clinic finder website today now that folks that are 65 and older or those that have 2 or more comorbidities can register for vaccine, and where that's now 1 million new residents are able to get vaccinated. The new VaxFinder website couldn't handle that sudden surge of folks this morning and crash, but it's back up and running. But there is a clinic that's available to Tewksbury residents in Lowell and Pawtucket Boulevard. It's the one that Lowell General / Circle Health is running. And the note for that for residents is that because it is not a state mass vaccination clinic, it's a regional vaccination clinic, you will not find that as a place to register on the new VaxFinder website. Instead, if you go to the town's website, so tewksbury-mass.gov, at the Right below the menu bar, there's a COVID-19 vaccine information and a red bar. If you hit that, right below the video, there is a note dated February 12th with a link on how to schedule an appointment at that Lowell site. So we'll be looking at utilizing go to if they don't feel like driving up to Danvers, Fenway Park.
Uh-oh.
He was on a roll.
I know.
Come back, Ray.
I can maybe talk a little bit about the sites as well. We spoke about it earlier. As he said, as the chair said, the website link is on the town website. It is not on the VaxFinder website. And the Council on Aging has been very gracious to offer anybody over the age of 75. If you need help registering, please give them a call. They can help you register to make the appointment. They may be able to help you with transportation assistance. I know that 211 has been very busy and not very easy to use as of late. So if you are over the age of 75, the Council on Aging is making themselves available to help you register if you need. All right, Mr. Chair, sorry, I filled in for you a little bit there because you disappeared.
Yeah, I lost my internet connection, so I don't know how far along my spiel I got. So thank you.
I think we got right up to where you said the Lowell General link on the town website.
Okay, good. So thank you for filling in for me. So the only other thing that I guess we as a town will do in talking with the town manager is that we will continue to work with our elected state officials to stress the importance of making sure that Lowell General, Circle Health, that vaccination clinic continues to receive the doses of vaccine that they need weekly in order to operate as a regional clinic, because in our region, that's the closest vaccination clinic that there are for residents of not only our town, but the other towns and communities that make up our MRC region. So any members have any questions?
Ray, could you repeat the instructions for the Circle Health sign up and where it can be found one more time?
Sure. Hopefully my internet will stay up for that. If you go to the Tewksbury Town Government homepage, right underneath the menu bar, there is a wide red bar that says COVID-19 vaccine information. And if you click on it for more information, if you scroll down, the very first story that's there, dated February 12th, is that Lowell General has opened up their mass vaccination clinic to Tewksbury residents. And the line right below it has click here to schedule an appointment. Because this is a regional clinic, it's not part of the state clinic, you will not find it in the new state's VaxFinder website. So anyone wishing to schedule an appointment at that location on Pawtucket Boulevard will need to use the link that's on the town website.
Great. Thank you, Ray.
Yep. Okay, so
Mr.
any other,
Chairman?
yes, Mr.
Yes, Mr. Chairman. So I've been in contact with a 92-year-old veteran of 2 wars that's homebound. How do we get him a shot?
Irvi, I'll let you answer that.
Sure. So we are still awaiting guidance from the state in terms of how to handle homebound seniors or the homebound population. As I mentioned before, this vaccine is very delicate. It's very fragile. The state really does not want us to transport it, even if it's drawn out into a syringe. So we are waiting for guidance. The state is working on it. And as soon as I hear anything, I'll definitely pass on the information to you.
I'm not sure if I can get them to stand in a line for too long either, so. But, okay, thank you.
So anything else from any other member? Any questions about COVID? Okay. Moving on, the other item for old business is continued from last meeting for East Celebrity Elite, 1500 Shawshene Street. They had requested appeal of a citation issued on December 3rd, 2020 for $300. It was a violation of the travel order and failure to abide by quarantine requirements. At the last two meetings, well, 2 meetings ago, so in the December meeting, they came and we had asked them to provide us attendance records for 2 specific dates of November 23rd and November 30th. And at the last meeting, they instead had presented us attendance records for December 3rd. And they then submitted attendance, the records that we had requested on the dates we'd requested the day following our last meeting. So we've had a chance to look at those. And one thing that I will mention is that I had gone to the school's website, or East Celebrity Elite's website late this afternoon, and I did find that they had posted the makeup of some of their teams. And coincidentally enough, there was a note on their webpage that the team rosters were effective November 30th. And November 30th are one of the 2 dates that we'd requested attendance records from. Initially, we'd requested that they simply copy their contact tracing log from those days, and Atson were informed they had not been maintaining that, and that's something now, I believe, Director Sullivan, that they are now doing per your suggestion, which I think is good. It's been something that was being done all along. But when I was looking at these attendance reports versus the team rosters, well, in the attendance reports, the names are presented first letter, first name, first letter, last name, and the town and state they're from. The team lists are full last name, comma, full first name. So I went through and just tried to compare where the initials seem to match first name and last name on the team lists. And what I emailed to you a little while ago before the start of the meeting were the 2 team lists from their website. For Monday, there was a 5 to 6:30 team and then a 7 to 8:30 team. And in both cases, there were discrepancies between names that did not match up between both the attendance roster as well as the official team rosters. So I just look at it. It's been a challenge for us to get the information, and just seeing the differences, even in the numbers of members of the team listed in the attendance report versus the official team roster that's on their website. To me, it just calls into question the validity of the information that they did finally provide to us. I know moving forward, I think you mentioned this to me, Director Sullivan, that eCelebrity Elite is now using the contact tracing log. So hopefully in the future, if there's ever a question or complaint phoned into the department, and you pass it over to them, they'll be able to just send you back the page or pages from the contact tracing log so you can see whether there is a new violation of the state travel order or not. But coming back to the two dates that we were questioning about, in my mind, I'm just puzzled about the differences when I compare the two team lists on their website versus the actual attendance list that was provided to us by the eCelebrity Elite. So with that, I'll open up to other members' comments, because now we are sort of in the deliberation phase of this. We closed the public portion of the hearing last month, so now it's time for the board to deliberate whether we rescind the citation or if we allow the citation to go continue to be in effect. So what other members have to say?
How confident do we feel that they are currently doing the right thing with the information that we've been given? I mean, I haven't been in contact with them. I'm reading what's sent to me, but I mean, Shannon, you may have more information on that.
I mean,
That's hard to say.
I always think that they're just giving us what we want to hear, and
Right.
that's my impression. I've never personally been in the gym,
Mhm.
but I've heard multiple stories from multiple complainers, and it's all kind of the same story, but it gets denied every time I bring it up to them. So I don't know why multiple parents would have like the same comments, and then we hear a different story from them. I don't know.
Okay.
And one thing I will mention is that Director Sullivan and I did have a conversation today about this very subject, and we get talking about attendance, and I believe Director Sullivan mentioned that when you were speaking with a parent had called in about a question, there was some comment made about attendance and that they're very strict in keeping track of attendance. And I went to actually the policy section on eCelebrity Elite's website, and they mentioned that they're very strict attendance requirements about you need to essentially be in attendance for every single practice, competition, and so on, and to notify your coach if you're not going to be present. So from what it sounds like, just like a sports team where coaches want to make sure that the players are all showing for all their practices or else you may be benched or off the team, it sounds like policy-wise, there's a similar thing here for cheerleading, similar to team sports. So someone's got to be keeping accurate attendance records. And what had been mentioned that what came on these reports that were submitted to us was they had to go into each student's record and sort of annotate when was that student there. So I just get conflicting signals or information from them about the veracity of the attendance record. And we can debate whether the state was correct in having the travel ban, and was it clearly, did it make sense for cheerleading practice school like this or not? But I think really what's before us is we ask for specific information to show whether the students and staff that were attending the various practices, whether they were all just from Massachusetts or not, because there were guidelines about coming in from out of state.
May I ask a question, Mr. Chairman?
Go right ahead.
Is the citation just that they have to pay a fine for, because I, like you, feel that the veracity of what they're telling us, and I don't appreciate the waste of time from our last meeting when I know Director Sullivan had clearly indicated what needed to be presented to the board that day. So if it's just a matter of paying the fine and the citation will hold, what is it, a $300 citation?
Yeah.
My recommendation is I don't feel 100% comfortable from what I had heard at the meeting last time. And as I said, I personally didn't appreciate having to revisit this a second time when it was clearly indicated what information was required. And I do understand, like I said, I don't think we have to get involved with what's going on with the state or whatever. I just think it was pretty much cut and dry. I do believe that with emails and text and phones, I know I think the proprietor of the business said that they couldn't get a hold of people. They had 24 hours. I just know that in the world I live in, and many people have access to text phones, when someone says they can't get a hold of someone, I could see one or two people going, but that's a little absurd to me that they can't get a hold of people. I know it probably would have been prudent with the confusion because the state did have some conflicting information out there that maybe it would have been better not to have the facility open that one day until information could be gathered that would be truthful and be clear to all the people that avail themselves of that facility. So if it's just a matter of the citation just on file, then I would recommend then just, let the citation, I wouldn't let it pass. I feel that there has to be some repercussions from what had transpired, and then let's move forward, because I do have some suspicions about what we're being told and what we're seeing. So I don't know how other people feel about it, but if it's the case, I'm saying let the citation stand, and if someone wants to second it, I'll make a proposal, let the citation stand.
Yeah, and that's why I'd gone through my little research and just made a presentation that, again, my point was not to say that what we got was incorrect information. From last time, it was more stressed that we just need to have the information that we'd requested. And I just, in my quick research, I just call into question the accuracy of what was submitted. So in my mind, if I don't have something that I feel is an accurate representation of who is there, then I look at that, called into question. To me, that doesn't meet what we are asking them to do.
I agree, Chairman. My gut feeling is I don't think we were asking for the world. I don't think we're asking for anything unreasonable. And I think the fact that we had to even get to this stage and then actually, like I said, waste another meeting last week and just have the legal verbiage that sometimes attorneys present that maybe weren't even aware of it. I just assume that's my recommendation. Let it be noted. Hopefully they'll learn from this situation. And like I said, nobody's perfect, but I think it's a learning situation for them. And hopefully they don't have to deal with this situation again. But at least while we have COVID-19 right now, it's probably prudent to just have a little reminder every once in a while. And I think the citation would be that reminder.
Okay. Mr. Rue, your thoughts?
Are we going to monitor them on a monthly basis for a time being here? Or are we going to just let this go at this? Or how are we going to go from here?
Director Sullivan and I had talked about this afternoon, and we asked for follow-up monitoring when it's been a food establishment that we've had to close and we've had to bring in a consultant, and we then have them submit monthly reports to ensure ongoing compliance. I think the root cause of this is that there had not been a contact tracing log that was being utilized at the very start of this that would listed the student's name, the time they were in, the time they left the property and their town and state. And I think as long as they start that type of a contact tracing log and continue it, then this way, if the department ever receives another complaint about potential travel order violations, all Director Sullivan has to do is call over there and just ask for the contact tracing logs for the day or days in question. Then that should answer the question. So I don't see a need for any type of follow-up reporting. I think it's just more that they need to be keeping the logs of who's coming and going each day, and then potentially as long as they submit a blank copy to the department, just so the department can make sure that it has the information that should be collected and that would normally be collected any other type of business, that we're not singling them out, then they're maintaining their record should be on them.
You're comfortable with the quality of the records you're receiving, right?
Well, I guess it.
See, I'm hearing a couple of different things. I'm okay. See, my whole point on this, my whole position on this is that Mr. Baker changes rules in the middle of the road when people are probably on their way from New Hampshire to the facility in Tewksbury. And I was, initially it's like, that could happen to anybody at any time with, the frequency of change coming down from the governor's office. But then what I'm hearing from you is that there's an issue with the quality of the reporting that we kind of need. And if and when we question it again, are we going to have the right numbers in front of us? So I'm okay with letting it go if you're okay with the quality of the information you're getting.
Well, I think it'd be more that as part of whatever motion we make, unless Director Sullivan, I believe you've already asked East Salisbury Elite to contact tracing log, correct?
Yes, I did, and they agreed to it.
Okay.
I haven't seen like the setup of the log or anything, but they agreed to start one, so.
Okay, so then we can just put in our motion for tonight that is part of our finding is that East Salisbury Elite provides the department with even just the blank template of what the form is, so that they're satisfied with the level of information that's being asked of people to fill out when they come in each day. Unfortunately, the department doesn't have time to conduct a full investigation, and the department reached out to Mass DLS to see if they could investigate, since the town doesn't have the resources, and they said that they were tied up. So I think our best thing is just to make sure that we have them use a form that we're acceptable with, and go from there.
Mr. Chairman, if I may.
Yes.
Number one, we're deliberating this evening based on their appeal of the monetary fine. And it would appear to me that this is a two-step process. Number one, they were given the opportunity to provide the credible information necessary for us to make an informed decision. And what I'm hearing is that we don't have the credible information to make an informed decision. So it seems to me that they've failed their burden of providing us with the information, and it puts us in a difficult position. Number one.
The board twice, I believe, Attorney Scorin.
I'm sorry?
I believe they failed the burden twice. They were asked to do it the first time, and then they didn't get it the second time. So that's what troubles me.
I think numerically you're correct, but we did allow them the opportunity at the conclusion of the hearing to provide that information. And from what I'm hearing is no one's comfortable with the information that was submitted. So correct, they failed their burden, whether it was once or twice. And here
Well,
we
my
are.
thing was, the meeting, I had a couple of questions to ask them before, and unfortunately it went into private session, so I wasn't able to ask the questions about it. So the way I look at it is, even though we gave them a chance to do it, I'm not dealing with little kids. I'm dealing with adults that run a fairly extensive business, and I expect them to know how to do their businesses the way they should. And so the way I'm looking at it is twice, but that's okay. But I think we're on the same page. Thank you.
And from a standpoint of making a decision, now we are presented with whether or not a twofold question. One, did they violate the travel order? And two, is a fine appropriate? So if we were to look at the initial question, did they violate the travel order? I don't have any credible evidence in front of me that would indicate that they did not. And therefore, I can't make a decision that would be favorable to them. I would have to find that they violated the travel order because there's no credible evidence in front of the board that would indicate otherwise. Secondarily, the question is, and I bring Charlie Rue's point up at this point, that there was confusion, that things change, and I don't think this is deliberate. And that goes to whether or not it's appropriate to fine them. Do we find this to be willful? Do we find this to be done in a manner that was deliberate? If that's not the case, if we can't find willful and deliberate, then I think the fine is inappropriate. But I would make a finding for the record that they violated the travel order. Secondly, I don't think they did it willfully or deliberately. And even though their evidence that they provided is less than stellar, would it be appropriate if we couldn't find some deliberate obviation of the rules to fine them? So that's what I would bring to the table, and to look at it as a two-part analysis and possibly a two-part vote. And I would just like to hear the other board members on what they think on that approach.
Well, one thing I'll just have Director Sullivan weigh in on is I think this was the fine or the citation was the third phase of the penalty. At first, there was verbal warning, then there was a written warning, and then it was followed up by citation. So the department, and you can fill in the details, Director Sullivan, had been following the state guidelines and advancing to the next level penalty based on what was happening.
Yeah, so we don't fine like right away. We issue a verbal warning, a written warning, like you said, and then a fine. So that was the case here.
I do not think it was deliberate either, although I do think prudence when the travel order changed, they probably, and I don't think this is in hindsight, I can only speak for things that I am aware of with people that have businesses. When someone's not sure, or if you're in a hole, you stop digging. I think it would have been prudent for them to maybe not open for that one day and then get their ducks in a row and inform people. As I said, when we're hearing the things that you say, Chairman, when you're looking on the website, and they sound like they have a strict handle on the business aspect of it, and I'm sure they have teams and competition. So I do agree with you that there's some conflict here, and my feeling is whenever there's a travel order, I know many businesses, when they weren't sure, they shut down for one day, and nowadays with communications, emails, text, Facebook, everything, I have a hard time swallowing that they couldn't get a hold of anybody because, like you said, it seems they have a better handle on things than they presented to us at the meeting. So I could be wrong, but I really don't think so.
Now that Sunday, November 22nd, the first day that we asked for attendance records. That, I believe, Director Sullivan, was the first day that the travel ban went into effect, and it was announced several days prior to that. And then Monday the 30th was 8 days after the travel ban had gone into effect.
Right.
it's-
And I had told her because I heard from DLS that bordering states were going to be added to that. And so I had kind of told her already before it was issued that this was going to happen. So she kind of knew it was coming. So that's my whole issue, is that she knew it was coming. She still allowed these people into the gym, and they didn't come forth with that information because they knew they had done it. So,
And they'd mentioned that fact at our last meeting, but why
Right.
that was the reason why they'd not submitted our requested information last meeting. So as I look at it, I would be all in favor of, from the two-part thing of upholding the issuance of the citation, and as part of our finding of fact is just that, in my mind, they did not provide us what I would deem to be reliable information in order for us to base our decision on.
Well, we actually have information to base our decision on. Whether or not it's reliable or not, I don't think is going to be determinable on the issue. The fact is that we asked for the information. We never received information that we could actually make a finding in their favor. So all we have in front of us is information that indicates that there was a violation. The violation continued through that week. And I don't think there's a question that the board wants to make a finding that there's a violation of the travel ban and the citation was issued appropriately. And I think that's the first step of the analysis. The second step of the analysis is, do we uphold the $300 fine? And is that the appropriate measured response by the board? So again, I will recap that I think we have to make a twofold finding of fact here. One is that there was a violation and the citation was properly issued. And two, whether or not the board would impose the fine. And I think it should be taken in two steps, and findings of fact should be made as it relates to the first one, that the violation has been determined to be a written citation that actually can be upheld by this board. And I think we should approach that.
Well, the citation and the fine are one and the same. So I don't think we can uphold the citation and say they don't need to pay the $300 fine, because the $300 fine is the third penalty that comes after a verbal warning and then a written warning.
So your point is that if we make a positive determination that the citation should be upheld, we really don't have any discretion to make a decision on the fine. It just goes with the finding of fact that the third and final warning is issued, and the fine goes with it.
Correct.
Can I just ask a question? Sorry, who's speaking?
No, go ahead.
Okay. Director Sullivan, have there been any other complaints in recent weeks about this business? Or
yes, there have been. I actually sent, because when we had them at the board meeting the first time, the board wanted me to send them a letter asking well, stating the complaint and then asking for a response from them.
Mhm.
So there were 2 complaints in the meantime of all this going on. So I had sent a letter, I think it was a couple weeks ago now, and I got a response this week from them, just stating what their side of the story was. So it's really,
Well, remember, folks, we have a record in front of us that we are deliberating what we had prior to the close of the hearing. And while I think it is important to recognize facts may have occurred after our public meeting closed, it's really not relevant for our determination. So I think we should go back to Mr. Bichetti's original motion that if we're going to make findings of fact that there's a violation and that's all it needs to be done, then the fine just goes with the violation.
Yep, no, I concur. So
I think
And I do think it's just a learning. I think it's a learning lesson. Someone was, things happen. I just think look at it as a reminder that their policies could have been a little bit better, and we've given them more than enough opportunities to vindicate themselves in this situation. And I just feel, like I said, I'm getting conflicting information that you have a business that's well run, does all these things, they have all the stuff on the website. And then I'm hearing stories. There's that old saying, am I going to believe what they're telling me or my lying eyes? Well, I hate to say my lying eyes are, I'm looking at what I've seen, and that's the basis of how I've based my decision on. And I know the thoroughness of Director Sullivan in doing her job, and I know she's probably giving people the benefit of the doubt and trying to do it, because we're not here to punish people. And as I said, I do not think it was intentional. I think there was confusion. But there's that old adage, measure twice and count once. And when you're not sure about something, stop, and maybe just stop the business that day, because there's a lot of public health ramifications by doing this. And I don't feel that that was the case in this situation, because when someone tells me in the 21st century that they can't contact people, especially a business where contact is so important, then it troubles me, because it just, this isn't rocket science. Everyone has emails, phone numbers, and everything. And like I said, I was having trouble swallowing that for what it's worth. And as I said, my faith in Director Sullivan is that I'm sure she was more than reasonable and fair with doing this. And it's an unfortunate thing, but like I said, no way do I believe it was deliberate. But I do think I think it's a wake-up call for this business and other businesses as well, because we do have a pandemic going on, and we have to do everything within our power to minimize the spread. And in spite of the craziness that's going on statewide, federally, and regionally. So I'm in agreement with my first position and with Chairman Barry too. So that's all I need to say. Thank you.
Okay,
It
so
sounds like, Mr. Chairman, that we've reached the time to do an up and down vote to uphold the decision relevant to the citation and the fine that goes with it.
right. So for the record, do you want to just state what the findings of facts are before we render a decision?
I think that the board could support the finding of fact that the violation that was cited by the director was cited correctly, and that the facts are, without any other evidence by the applicant or the appellant, that we could uphold the decision of the director to issue the fine.
Okay. So did you want to put forth your motion then?
I'll make a motion that the decision of the director to issue the citation and fine should be upheld based on the information provided and in front of the board prior to the close of the public hearing.
Okay, someone willing to second that motion?
I will second it.
Okay. So motion's been put forth and seconded. We'll take a verbal roll call vote. Vice Chair Scarano.
Aye, to uphold the citation.
Okay. Mr. Rulis.
Aye.
Dr. Bichetti.
Aye, to uphold the citation.
Mr. Rue.
I'd like to abstain from this vote based on the confusion issued from these executive orders from the top down. I mean, I wouldn't know one day to the next back when this occurred, who was on first or what was on second.
Okay, so you abstained. The chair votes aye, so the motion carries 4 yeas and 1 abstention. So the citation is upheld. Okay. Moving on to new business. I put on a item that former Director Sawyer and I have been talking about, and Director Sullivan and I have been talking about, and I discussed with town manager this afternoon of just to be good to, in advance of people going back to restaurants when things are finally starting to get back to normal. It's been a while since the restaurants have all been fully inspected. So we've all thought that it'd be very good to bring someone on board that could go through on a contract basis and do an initial inspection of all restaurants. So at least the baseline inspection is done, and then the department's able to continue on with the inspections. So the town manager is looking at trying to utilize some of the COVID-19 relief funds to pay for this, but I just thought it'd be good if the board is all supportive of it, that we just make a motion that we support this idea. Not that there's any contention about it, but I think it'd be just a good show for us and for the public too, that we'd like to know that the public feels comfortable going back into restaurants as more people get vaccinated and as the restrictions finally get lessened, that they'll be safe in knowing they're going to a restaurant that is safe sanitary wise for them. So any questions or discussion for the director in this, or anything you want to add, Director Sullivan?
No, I mean, the state right now for COVID has said we can do just 1 food inspection a year, but with COVID, as you said, it's been really hard getting out to the restaurants because our attention has been mostly focused on COVID. I was able to get a few done at least last year, so some of them have been inspected, but they're definitely due to be inspected again.
I think it's a great idea.
Mr. Chairman,
Yes, Mr. Rue.
do we have somebody in mind, or is this open for,
Well, I believe that when I had discussion with town manager today that Director Sullivan's part of, that he mentioned one thought might be that when they had applicants for the open health agent position, that potentially one of those might be suitable. But again, I'm not sure who might be available to do this.
Yeah, as of right now, we don't have a specific person yet, just because some of the applicants don't know the food code. So We were thinking more if we were able to get like a COVID position. One of those applicants could potentially work as a part-time like COVID compliance. So that way we could focus more back on our normal day-to-day in the health department.
For the record,
The
if
reason
anyone
I asked is-
for the record, if anyone needs any help, I did pass the ServSafe. I guess I could open a restaurant if I wanted to, just so I'd be willing to help in that capacity when I'm available, just to make sure that has always been a primary concern. All our food establishments are being safe for all our people in our community. So for what it's worth, I'd be willing to help in the interim till we find someone to do that on the days that I may be free.
The reason I asked is, you know, I know people in the business that are ServSafe certified and whatnot, and I didn't know if you wanted to put some names forward, or if we wanted to contact people to contact you, or how we were going about that, or if there was already somebody tapped. That's the reason I asked. That's all.
Mr. Chairman, I was just wondering if Director Sullivan's point was more akin to it's the COVID that is affecting the ability for her to go out and do inspections. And it sounded like if there was assistance with the COVID portion of her responsibilities, it would free her up in order to go out and do inspections as she's qualified to do. So it would seem to me that it's not so much the help on the inspection end, it's the help on the COVID end that would free up her time. If I'm not mistaken, I'd like to put that in front of Director Sullivan.
Yeah, I think also, and maybe we don't need to make a motion one way or the other, because I don't want to tie their hands or indicate how they're to operate, but it was more just at least that we support whatever you think would be the best option, Director Sullivan, whether it's someone that comes in to help take over or oversee the COVID part of what's been taking all of you folks away from your routine jobs so you can get back to your routine jobs, which probably makes a lot of sense, or having someone come in and do the initial inspection. So I guess I would defer to your best judgment about how best to do it, but it seems like, at least I'm talking with the town manager, that he'd be looking at using the COVID-19 relief funds to fund this work. And if that's the case, then it's probably easier justification to have someone come on board to help with the COVID work to then free you folks back up for the things that you should be doing.
Yeah, I think our restaurants could use a one-time inspection just to get us back up to the level that they need to be at when we go in, so we don't run into problems in the future. You know what I mean? Just so the public, I mean, some of them, it's been a while because that's just how it is. When's the last time I've been there? I don't know. So I think it would be good for them to be inspected.
Mr. Chairman,
Yes.
my point was basically, from the get-go of this COVID thing, we don't know what Mr. Baker's going to drop on these guys next week or tomorrow in terms of responsibilities for resources we don't have. And I know that other towns do hire contractors to do the restaurant inspections for them. And I thought what this was about was we were going to try to get part of that load off of Shannon's desk to free her up to kind of entertain the phone calls when they come in from the governor's office, because we really don't know what's going on from one minute to the next with that guy.
Yeah, I think that was my original intention, but I mean, Director Sullivan has a valid point too, that it would be nice for them to be able to finally get to the roles, or for our town nurse, for that matter, to actually get to the role that we've hired her for, because she's been tied up in COVID since she started day one. So I think I'd leave it up to them to see how they best see moving forward, but at least I wanted to have the discussion that we were all in support as a board for having some type of assistance in the health department. Again, how that's funded, that's up to the town manager, but it seemed like you'd be able to use the COVID-19 relief funds. But I think it was more just that we recognize that having the initial inspections done would be a very good thing, especially to improve public confidence that it's safe to actually dine out. And I guess let them decide best how that would be handled, whether by them and they have someone come on to take care of the COVID work, or they hire someone on a contract basis just to come in and do the inspections. And I think that's really more borne by whom they might be able to get.
Okay, I'm in favor of that.
And then, Mr. Root, to your point, I mean, if you want to pass names off to Director Sullivan, at least they'll have some names that if they decide to get someone to do the rest of inspections to the COVID work, at least they'll have a pool of names to look from as well.
Well, again, it depends on what they're looking for. I know people in different aspects of the business, you know, in the health business, and it would really depend on what she was looking for. But in terms of, you know, having a degree, you know, in COVID-19, we don't have one, and we're going to be called upon to do things probably we have never heard of yet from the upper office here. And I don't know if we're going to get anybody qualified any more than the people we have currently working for the town. But that being said, I'm all in favor of any resource we can get in here right now. Thank you.
Okay. So I don't think we need to make an actual official board motion, but I just at least want us to have the discussion and let Director Sullivan know that whatever effort she's able to bring someone aboard, that we fully support that.
Thank you.
Okay. Moving into director reports. So Lisa's Pizza update.
So I haven't heard, I haven't gotten a report from them yet this month, but I would assume it's coming. So when I do, I'll send that over to everybody. So that's really the only update I have for that.
I guess the only piece to add to that is that have you received any new complaints about Lisa's Pizza since our last meeting? Okay. Well, that's good to hear. I don't think we have anything on board reports, because I think, Maria, you said Tewksbury Cares is sort of taking a hiatus right now during this COVID.
It has. It's had to take a little break. It's been difficult for everyone to get together and have meetings and all of that. So right now, where Maria is still putting out information, and then we keep blasting it out as we can and let people know that we are still here for people if they do have questions or need help, and the resources are there. But aside from that, all fundraising efforts are temporarily unavailable, and we haven't been able to meet in recent months.
Okay, well, I can tell you firsthand that there's been a lot of traction on Facebook.
Yeah.
So Maria has been putting a lot of content up there, and there's been a lot of likes for that contact. So at least well utilizing that source. Okay. Irvi, I know we had you talk about COVID at the start. Anything else you want to update us on in terms of COVID or any other public health nurse related items?
I think we're kind of in a holding pattern right now. The case numbers as across the state, you know, the numbers are also coming down in Tewksbury. So we've had a little bit of a of a reprieve. I don't expect that it will last too long, but hopefully it will. But no, I mean, recent times just been trying to get vaccine. That's really where a lot of our efforts have been. So no, nothing really else going on.
Okay. So anyone else have anything they want to bring up tonight?
I was just wondering if Irby had a grasp on any of the mental health situations out there with any of the students or younger crowd as it relates to the effect of COVID, not the disease itself, but the effect of the disease on the students.
Kelly Constantino, the lead school nurse, and I are in contact pretty much every day. Nothing that she's brought up to me. I will ask her though in tomorrow during our next conversation, just to check in. That's a valid point. Good. It would be good to check in just to see how the kids are doing.
I will just pass on one comment I heard, and that was when I was working at the COVID clinic for first responders last Wednesday, and I was working with a Westford school nurse, and I seemed to be at the Westford corner there. Their concern in their town, at least, was in the lower level schools where the students were much more remote. The fact that the normal resources, school counselors, psychiatrists, psychologists, the students did not have a chance to interact with them nearly as much as they did before COVID times. So there was some concern about students potentially lacking normal access to those resources, and they're looking at ways to try to see what can be done about that.
Okay. I can check in to see how we're doing in Tewksbury to that end.
Okay. And I know each town is doing their education model differently, so I'm not sure if there are similar concerns here in town or not, but at least in Westford there was. Okay, any other items to bring up tonight before it's Mr. Rue's turn for his motion?
No, thank you.
Okay. Hearing none, Mr. Rue?
Mr. Barry, I just want to make a mention that Malden Catholic is in the semifinals. They're playing tonight in Canton, and my brother's son, my nephew, is in the goal, and they will win again. That in mind, I'd like to make a motion that we adjourn tonight's meeting and go Malden.
And that goalie happens to have the last name Rue, coincidentally.
That's correct.
That goes not unnoticed. So who'd like to make a second to Mr. Rue's motion to adjourn tonight's meeting?
I'll second the motion.
Okay. Motion's put forth and second to adjourn tonight's meeting. We'll take a roll call vote. Vice Chair Scarano.
Aye on Mr. Rue's motion to adjourn, and aye on good luck to the Rue family.
Mr. Rulis.
Aye.
Dr. Vachetti.
Aye.
Mr. Rue.
Aye.
Chair votes aye as well. Motion carries unanimously 5-0. So it is 7:10 p.m. Good night, Tewksbury. Good night, everyone.
Good night.